Hi, this is John O with Doc Affinity. Thank you for visiting us on YouTube. This educational video is part 2 of our discussion on healthcare reform and the impact it has on health insurance. In this presentation, we'll be focusing on the Health Benefit Exchange. Let's begin with some definitions. A health benefit exchange is a central marketplace where individuals and small businesses can purchase insurance from multiple carriers. On the exchange, insurers must adhere to common standards. This makes product comparison a whole lot easier. The exchange is also the only place that administers tax credits and subsidies. If you'd like to learn about the various tax incentives, please visit our website or feel free to contact us. For small businesses, there are 3 key advantages to the exchange. The first advantage is product choice. You're going to find a bigger selection of products in the exchange versus outside the exchange. The second advantage is that employees can choose among several or many different insurance products. Usually, employees of small businesses have no choice. They go with whatever insurance the employer selects for them. With the exchange, the employer defines the universe of insurers and products, and then the employees choose from within that universe. Having choice is a good thing, though it does require some thinking. The third advantage is multiple employer contribution options. This also requires some thinking, but a properly designed contribution structure can engage employees to help manage insurance costs. Together, these 3 advantages are big pluses for small businesses. They allow the broker and the employer to develop a thoughtful and more cost-effective health plan. In the past, only very large businesses had access to these types of tools and levers. So let's explore each of these advantages in greater detail. Advantage number 1, product choice. For the most part, all of the insurers in the marketplace will participate on the exchange. Every insurer will offer at least a benchmark product. All of the benchmark products will have the identical benefit design, meaning what benefits are covered, what's not, how many visits, etc. The main difference, one insurer versus another, is the provider network. There will be 4 variations of the benchmark product. These variations are referred to as metal tiers. A metal tier defines the level of cost sharing. For example, a platinum tier will on average cover 90% of healthcare costs, which means out-of-pocket costs should average 10%. We said this before, but standard benefit levels and cost share arrangements make it much easier to compare products. For illustration purposes, let's say Oxford Health Plans has 3 products for sale on the exchange, the benchmark plus 2 others. Let's assume that Oxford offers all metal tiers for the 3 products. This means customers will be able to choose from 12 different product options, and this is just one insurance company. The same multiplication would apply to Aetna, Empire Blue Cross Blue Shield, Emblem, Cigna, and so on. Advantage number 2, the employee choice model. With the exchange, the employer defines a universe of insurers and products, and then the employees choose from within that universe. Let's take a look at the various models that are available. The first is called one insurer multi-tier. For very small businesses, this is a great option. It's simple to explain. The employer selects one insurer, and let's assume selects the benchmark product. Next, the employer decides which of the cost share arrangements to make available to its employees. In our example, the employer selects all 4 metal tiers. Generally, you'd expect the healthy employees to gravitate toward the lower price products, bronze or silver, while the employees who need more coverage will select either platinum or gold. The end result is that employees buy what they need, not more, and the employer will likely save money. The second employee choice model allows more than one insurer. This option makes sense if the provider network of one insurance company does not meet everyone's needs. In our example, the employer selects 3 insurers, but only the gold and silver tiers. Some employers may feel that a bronze plan does not provide adequate coverage. Others may feel that a platinum plan is too costly. Third, the full menu model. It allows access to all insurers and all products. Generally speaking, we don't recommend this option for small groups. Too much choice can be overwhelming. In addition, it's the responsibility of the broker to help employers find the right balance. Advantage number 3, multiple employer contribution options. Employer contributions can have a strong influence on how employees decide. With multiple options, employers can now be more strategic in the way they contribute to premiums. The first option, the flat percentage. This is the norm today. As long as the percentage remains fixed, both the employer and the employees are subject to the same annual increases. Second, the fixed dollar amount. It gives the employer more control over annual increases. Let's say the employer wants to budget for a 5% increase next year. Using our example, the employer is contributing $400 per month this year. Next year, the employer would then contribute $420 per month. However, the percent increase for employees will likely be higher than 5%. Basically, the fixed dollar option makes it easier to shift more of the annual cost increases to employees. Lastly, the cap percentage. This is an interesting option. It combines the features of the flat percentage and the fixed dollar amount. We like this one a lot. The employer benefits when an employee selects a lower price product, and if an employee selects a higher price product, then the fixed dollar limit kicks in. Previously, we said that the health benefit exchange allows the broker and the employer to develop a thoughtful and more cost-effective health plan. Let's summarize why this is the case. Number 1, having enough products to choose from is obviously important. The health benefit exchange provides that. Number 2, the exchange provides employees with choice. Employees must now decide what to purchase with their money. They'll want the most appropriate insurance coverage and to eliminate wasteful spending. In essence, employee choice aligns the interests of the employees with that of the employer. Number 3, the exchange provides employers with multiple contribution options. These can be used to reinforce the financial incentives for employees to choose wisely. We'll use an example to illustrate this last point. Let's say we've got a small business with 2 employees. Both enjoy excellent health. They hardly use their insurance. Given the employee choice model, the first employee instinctively knows to buy a lower priced product. However, the second employee, perhaps due to risk aversion, is leaning toward a more expensive product that probably doesn't make sense. Using the cap percentage contribution, the employer could potentially sway the second employee to make the smarter choice. For a more detailed case study, please take a look at our videos under the Health Insurance Strategies section. In conclusion, with the health benefit exchange, the rules for purchasing insurance have become very favorable for small businesses. Choice and flexibility does require some thinking, but we absolutely believe that the benefits are worth the extra work. If you would like some assistance in designing your health plan, we're here to help. Thanks a lot for your attention, and please consider leaving a comment. We appreciate the feedback.